Mental disorders are tormenting for some people. When they cannot tolerate the ill effects of mental disorders, some of them may decide to end their lives. This is the most tragic outcome of some people suffering from a mental illness. Recently, the society is increasingly concerned about the clusters of young people suicides in Hong Kong. Many people are also very concerned about students' mental health issues. While youth suicide is indeed a serious problem in Hong Kong, we should not forget that many adults, especially our elderly people, also suffer from mental ill health and committed suicide. Let's jump out of Hong Kong and look at the situation in Asia. In Asia, the suicide rates of different countries and regions vary a lot. This is because of the differences in socio-economic development, population size, literacy rates, and religious beliefs in different countries. The suicide rates in Thailand, Singapore, and India are low. The rates in Hong Kong and Taiwan are medium. High rates countries include Sri Lanka, Japan, and South Korea. It is noteworthy that about 60% of world suicides happen in Asia. Unfortunately, most of the discussions and evidence-based prevention initiatives are developed in non-Asian societies. In other words, we really do need a lot more people, forces, organizations, experts, researchers, and resources to invest their time and efforts into suicide prevention in this region. Suicide is a global phenomenon. It happens in all regions across the world. According to the World Health Organization, one person dies of suicide every 40 seconds. It is estimated that close to 800,000 people die due to suicide every year. There are 7.347 million people in Hong Kong. 800,000 equals to 1/10 of the population in Hong Kong. That's a lot of lives lost due to suicide every year. In fact, 800,000 is very likely to be an underestimation. The actual number might be even higher. Why? Some cases may have been left unreported, especially in countries where suicide is a taboo or illegal. Some countries do not have an effective system for death registration, therefore some suicide cases may have been uncounted. Sometimes suicide may also be misclassified as an accident or another cause of death. So it is very likely that more than 800,000 people die of suicide every year, and many more people attempt suicide. Among those who have committed suicide, many were unfortunately young people. Suicide is the second leading cause of death among people of the 15 to 29 year group. In some countries, the suicide rates are even the highest among the young. According to UNICEF, in 2012, suicide was the leading cause of death among young people in high-income countries such as New Zealand. There are multiple risk factors contributing to suicide. Some factors are associated with the society, community, relationships, and individual characteristics. Risk factors associated with society include barriers to accessing healthcare, stigma against people who seek help for mental health problems, inappropriate media reporting about suicide. For example, if the report gives too much details of or sensationalizes suicide without giving readers advice on how to obtain help, it may increase the risk of copycat suicides. Easy access to the means for suicide, such as drugs, is also a major risk factor. In Hong Kong, more than 80% of the population live in high-rise buildings. This provides an accessible and lethal method of suicide. The case fatality rate of jumping is over 90%. Risks linked to the community include war and disaster, discrimination, trauma or abuse. Risk factors associated with relationships include sense of isolation, lack of social support, relationship conflict or loss, For example, in Asia, family conflicts is a key risk factor for suicide among women. On an individual level, risk factors include mental disorders, previous suicide attempts, harmful use of alcohol, chronic pain, a family history of suicide, hopelessness, job loss, financial loss. In Asia, stresses in life, such as poverty, are common risk factors leading to suicides among men. Examples include work-related factors, job loss, and gambling. Compared to the West, financial problems are more commonly found among suicides in Asia.